Now, a great-grandfather from Peacehaven has become the first patient in Sussex to receive a very new and very precise type of cancer treatment. Peter Tuppen, who's 78, who has lung cancer, has been given an innovative and life-saving type of radiotherapy. And Peter's wife, Helen, joins me on the line now. Good morning, Helen.
Good morning.
Before we talk more about the treatment and its impact, how is Peter doing at the moment?
Not too bad. He's very tired, but other than that, he's fine.
Okay. And what was it like when you were offered this chance to try this new treatment?
Well, at the time, obviously, we didn't realise Peter had cancer. That was picked up on an MRI scan when he went to have his heart checked. And within days, he was asked to have a PET scan. That's when they told us he'd got this tumour in his lung. The first thing he was offered was to go to London. And that would have meant travelling to London every other day for 5 treatments. But due to tiredness, he, declined. And they said, well, if you can hang on, we will be able to do it at Brighton. So he was very, very pleased.
Oh, that is great. I mean, that just has such an impact on people's lives, doesn't it? A lot of people have to travel great long distances. And if you are already not feeling in the best of health, this can really, really take it out of you. So this new treatment is called stereotactic ablative radiotherapy. Have I got that right?
Yes.
Tell me a little bit more about this. This is very targeted beams of radiation.
Yes, prior to having the treatment, he had to go down to the cancer centre where they tattooed little dots on his chest. And then they, I think it was a few days later, they started the treatment and they literally targeted these little dots on his chest. And then 2 days later, we went for the second treatment, and then they marked him again with little dashes and dots, and they aimed the radiotherapy at him again. And that's how it went on for the, it was 10 days in total, but only 5 treatments with 1 day rest in between.
So I'm reading here that sophisticated image guidance technology takes into account breathing motion in order to ensure that these beams are targeted so accurately that means that these higher doses of radiation can be delivered as safely as possible, and also cutting the number of hospital visits that cancer patients need to make. Presumably that's made a big difference too.
Oh yes, definitely, because if he'd have gone just for the normal radiotherapy, it could have been anything from 20 to 30 sessions, and you only had to have 5 of this new one.
Oh, that's amazing. Now, I know that you have to wait a little bit longer. What's next for Peter? Another scan?
Yes, the oncologist rang yesterday, and she sort of asked how he was, etc., etc. And he's got to wait to the end of October, and then it's going to be a face-to-face appointment with her. And then about a month later, he'll go for another CT scan to find out if the tumour shrunk or whether it's gone. It's just waiting, really.
Well, all the very best to you and Peter, Helen. Thank you so much for joining me this morning. I really appreciate your time, and our thoughts to Peter as well. Dr. Juliet Brock, who is consultant clinical oncologist, has said it's been a tremendous team effort to set up this service as part of the national initiative and provide this specialised and effective treatment to cancer patients across Sussex. And the rollout at University Hospital Sussex NHS Foundation Trust is initially aimed at treating patients with non-small cell lung cancers and will be extended to include other cancers in future.